Hi, I'm Dr. Cooperman and this is Dr. Romao, and today we're going to be discussing the difference between braces and Invisalign. As time has gone on and technology has changed, we've been doing more and more Invisalign within our practice. In fact, at the moment, we're among the top 1% of orthodontic providers who give Invisalign to their patients. However, that doesn't mean that we don't love braces. There is definitely a place for braces in our practice, but we want to give you the tools so that you can make the choice that's right for you and your family.
So braces are the more traditional or old-fashioned way of doing orthodontic treatment. Braces consist of these metal or ceramic brackets that are glued onto the surfaces of each tooth. Then there's a wire that connects everything. When you have braces, you come to our office about every 4 to 6 weeks for adjustments, and that's how we get the movements that we want. When you have braces, you have to be very, very careful about what you eat and have to make some changes to your diet. You want to stay away from foods that are too hard, chewy, or crunchy. If you do eat foods like those, what can happen is the brackets can pop off, which can cause unnecessary emergency appointments and also make your treatment last longer. The other thing you have to be very good about when you have braces is making sure that you clean them very, very well. The brackets are great spots where plaque can accumulate. Very unsightly stains can form once the braces are removed. Now, Dr. Cooperman is going to go over some of the differences with Invisalign treatment.
Yes, so Invisalign is just very, very different. With Invisalign, you get a series of clear, removable retainers, aligners, that you wear 24/7, except for when you brush your teeth and when you eat. But for everything, work, play, study, especially sleep, you have those aligners in place. And so we also place small attachments, little tooth-colored bumps on the fronts of some of the teeth in order to make sure that the teeth move predictably during the course of your treatment. Now, one very important difference between braces and Invisalign is that with braces, you do have to be very careful about the food selections you make. With Invisalign, you can eat anything you want. Just take out the aligners, eat, make sure that before you put the aligners back in, that you clean the aligners and that you also clean your teeth, because you don't want to be putting a dirty aligner in over dirty teeth. One other very important difference is the frequency of your visits with us. With braces, we see you about once every 4 to 6 weeks. With Invisalign, it's about once every 8 to 10 weeks. Plus, you have the ability to do some of those visits virtually, where you take photos of your teeth, you send us the photos, and then we sit down and we analyze the progress of your treatment and have essentially a fancy Zoom meeting where we can discuss any concerns that you might have.
One of the questions that we get asked pretty often is, what type of treatment would we pick for our own kids? Well, we picked Invisalign. We feel it's more comfortable, there are less appointments required, less emergencies, and it's also much easier to keep your teeth clean with Invisalign. So, rest assured, whatever you pick, either Invisalign or braces, you're going to get the same result in the same amount of time. There's no wrong choice. Just pick what you feel is better for you.
Yes, one thing though that is the same between braces and Invisalign, it is important that you continue to see your dentist regularly every 6 months or whatever they recommend, because we want to make sure that if there is any sort of small cavity or anything like that, that it's caught early before a small problem becomes a big problem.
That's right.
And that's the story.